Dr. Anita Haque here, your chiropractic coach. So one of the questions I had from a YouTube video I posted recently was how to do drop table more effectively for your patients, especially when you're adjusting their lower back. So I wanted to show you guys a couple of ways, or show you exactly kind of the way that I do it. So we'll start off here with my patient. And first and foremost, of course, for palpation, we can check leg length, right? And so as I'm checking her leg length, I'm just gonna pull on her feet. I notice the right one's coming up short, which is interesting because usually this patient, I've noticed her left one coming up short. So that's gonna give me some indication, of course, maybe if she has a PI, posterior SI joint on the right side, or if her pelvis is shifted up, and automatically it is absolutely accurate. This right spot here, is that right? Do you feel a little tender in there?
It does feel tender.
The patient will also tell you because they'll notice, ooh, it's a little sore there. So that's what I'm going to be adjusting. So what I'm actually putting my fingers on here is the shelf or the roof of the pelvic bone on the right side. And that's what's rotated and kind of tilted this way, which is an up. So that's why this leg is coming up short. So my goal on the drop table will be to bring that pelvis back down. So that my motion when I drop table is similar to as if I'm just doing a P-Day movement without the drop table. So my goal will be to push this pelvis down. So how I'll do that, first and foremost, I'm gonna start, you know, if you have a drop table, you probably know exactly how to raise it up. But what I like to check first is the tension before I start using the drop table, because obviously it's gonna shift based on your patient. And I wanna make sure I have the right force and not too much force, of course, because you don't want to make your patients more sore when you're adjusting them. You want to make them feel as comfortable as possible. So one hand I'm going to use as my support hand. This is going to help to stabilize her tailbone. Since I'm going to be adjusting this right SI joint and the top of the pelvis, I want to keep my hand to stabilize in the middle of her tailbone or the sacrum, and then the other hand is going to come on top of the segment that I'm adjusting. So again, that right PI. So, and then I'm going to use all my force and my body weight to drop down and push it this way. So let me demonstrate that for you. I just wanted to break it down because it goes so quick, right, on the adjustment. So here we go. Sacrum is stabilized with my right arm. I like to do a crossover. You don't have to do it this way. And then this hand, you'll notice I also moved my body the way that I want the bone to move. And it just helps to intensively adjust that segment in the direction you want it to move. So let me show it to you again. And you can do on a drop table, I do it maybe 2 to 3 times to reinforce. Sometimes it's just once, but usually 2 to 3 times I kind of solidify that joint to move in and get adjusted. So let's do that again. How are you doing? Does that feel okay?
I'm good.
Okay, as long as your patient's comfortable. So again, my hand is stabilizing the sacrum, opposite hand. I'm twisting around, and you'll notice I'm dropping my entire weight. And it's safe to do that because we know the drop table will protect the patient from getting too much of your force. Let's check it out and see if that made a difference. I'm already feeling it's a little better. I'm gonna go out one more time. So this will be kind of number 3, and I'm gonna go a little more lateral on the lateral part of the pelvic bone, just because I feel like it still needs a little maneuvering. And there we go. And now I'm just double checking, seeing if we have that adjusted. And of course, I can come back here to her heels and see, yes, they have leveled out. So they're equal now, which is a great sign. Now, let's say you want to do a low back drop table on the lumbar, so not so much on the sacrum or the SI joints. The tailbone will be the same way. You would just hit the sacrum where you want. But on L5, L4, L3, any of the lumbars, I like to check first with the SPs. Are the spinous processes out of alignment? Am I feeling a subluxation? And when I do feel one, I know, I'm sorry. I know you can feel it because it's tender and it's stuck here. So I can see she needs an adjustment here. What I'm going to check with her before I start using the drop table is how is that SP moved? So let's say my thumb is her SP. Is it to the right or is it to the left? Hers feels like it's to the right. So when I drop, my goal is to move this SP back. So I'm going to be contacting my hand on the left side of her TP, the transverse process, so I can help bring that back, if that makes sense to you. You can alternatively drop table your hand placement on right near the SP to push it the other way. So I'll show that to you both ways. So again, it's a little bit off to the right. I'm going to make sure that the tension is correct for her on the drop table. Okay, here we go. So I'm going to place my pisiform on the TP of the segment that is subluxated to the right. So I'm on the left TP, so we can push that down. My opposite hand, again, you don't have to do a cross. I just feel comfortable that way. Make sure her tension's not too hard, especially on the lumbars, L2, L3. You want to go a little lighter, err on the side of caution, because it can be very sensitive to your patient. And it's better to do multiple drops to get it right versus one big drop that can hurt them. Okay, so take a deep breath just to relax your patient. And most of my tension, are you okay?
Yeah.
Most of my tension and pressure came onto that TP. So I'm gonna just double check it. And we're gonna do it a couple more times. Now let me show you the way you could drop table just to move the SP, okay? The spinous process. Same thing, but I'm going to make sure most of my pressure is gonna come to move that SP. So how I'll do that is my other pisiform is kind of right up against that SP process. So when I push down with the drop table, deep breath again, and now I'm making sure this hand, which is this hand here, on that SP is helping to bring it this way. You use your body according to what's more comfortable for you, docs, because your patient can tell when you feel comfortable. And when you feel comfortable in your hands and confident, they'll relax and get a better adjustment. I hope that this demonstration on using the drop table helps you, and please keep your comments and questions coming. I'll be back again with another tip for you.